Okay, the next topic is physiology of osseous tissue, mineral deposition and resorption. That's obviously mineralization. Mineral deposition happens due to the fact that calcium as well as phosphate is going to be deposited in your bone, and this is necessary so the bones can be strong. The next topic that we have in here is mineral resorption. Mineral resorption is the process of dissolving the bone, and this is necessary, for example, when we need to have calcium available in our body, such as the nerves, for example, need calcium in order to function. Then again, we have a process called mineral resorption, and the cell that is responsible for that is going to be the osteoclast. So when you have the calcium necessary for your body to perform the job, then obviously the calcium is going to be in homeostasis. But many times the calcium is not in homeostasis. Basically, you don't have the levels of calcium necessary in your blood. Either it's going to be too high, hypercalcemia, or too low, hypocalcemia. Hypocalcemia, as you can see here, obviously that causes muscle spasms. Then what is it your body is going to do to increase the levels of calcium when you are in hypocalcemia or decrease the levels of calcium when you are in hypercalcemia? Well, in that case, your body is going to use different hormone as well as a vitamin. The vitamin is calcitriol. Calcitriol is basically vitamin D. Vitamin D, as you can see here, needs 3 steps. One step is at the level of your skin, the other one is at the level of your liver, and the other one is at the level of your kidneys. So you need 3 different organs in order to have normal amounts of vitamin D. What vitamin D is going to do, vitamin D will go to your Vitamin D will go to your intestines, and in your intestines is going to help you absorb calcium into your body, which is necessary to have the normal amount of calcium in your blood. Okay, that's what you have right there. The next one is going to be calcitonin. Calcitonin is a hormone produced by your thyroid gland. The thyroid gland has C cells, and the C cells are in charge of producing calcitonin. What calcitonin is going to do, calcitonin is going to reduce the levels of calcium in blood. How is it going to achieve that? Calcitonin remove the calcium from your blood into your bones. Therefore, what is the name of the cell that is going to put the calcium in your bones? Osteoblast. Therefore, there's going to be an osteoblast stimulation by the calcitonin, so you can remove the calcium from your blood and put it into your bone. Obviously, it makes sense to have the osteoclast inhibition, right? So the calcium does not get removed from your bones. The next one, parathyroid hormone. Now, the parathyroid glands produce parathyroid hormone. The job of the parathyroid hormone is basically to increase the levels of calcium when the levels of calcium in your blood are low. They're going to act by stimulating the osteoblast, and the osteoblast releases a substance called Rankel, which in turn raises the levels of osteoclast population. Phosphate homeostasis, we don't have pure calcium in our blood. What we have is calcium phosphate. That's why we need to talk about phosphate homeostasis. It's very important because phosphate is going to help us maintain the levels of pH in our body, for example, because it's going to work as a buffer. It says other factors affecting bone. Obviously, in addition to the hormones that we were talking about, aging also affects this. The older you get, the more problems you're going to have with the calcium, whether you want it or not. Your vitamin D is not going to work properly. You're not going to absorb that much calcium at the level of your intestines anyways, just because your digestive system will not work the way it's supposed to be. Right here, table 7.1, you have some of the hormones that are related to calcium, and that's about it.